Howdy, Professor Kalbasi. We are Group 8, and we will be focusing on diabetes in rural Texas communities. So one of the articles I found was research that was specific to Texas, and it said by 2050, diabetes prevalence among Hispanic groups will be projected to increase by 149%. And this just puts emphasis on why it's important to understand the risk factors influencing the onset of diabetes. Another thing for culture was that many of them find comfort and ritual involved in like eating foods as part of their culture for generations. So this could also play a factor in like the high incidence of diabetes prevalence because of the type of consume.
Howdy, I'm Juana, and I'm focusing also on risk factors and determinants, but I'm focusing on the socioeconomic and like the lack of resources. So for the first article that I found, it was a study where participants from rural Texas areas are asked about their hardships in accessing food and coping mechanisms, those hardships into 9 categories, and also offered ways in would kind of cope with these. In the second article, it talks about the lack of resources. As diabetic patients, they need endocrinologists, and they ended up finding out that here in Texas, out of the 54 counties that have a high diabetes prevalence rate, only 22 of them have an endocrinologist. And lastly, for the third article, it's a study regarding education in rural schools in Central Texas, and it gives a lot of background information. It also talks about how personnel is not equipped to give or teach about diabetes.
Hi, my name is Danielle, and I focus on the preventions. It was intro on diabetes education, and basically in summary, this said that there needs to be intensive lifestyle interventions that can lead to dietary and physical activity change that can help delay or prevent type 2 diabetes. This can be such a positive change in the community. The second article I focused on was diabetes cost. And this basically stated that costs have increased, and now there's a greater percentage, over 10% prevalence of diabetes in the community. This just highlights the importance of to control the costs, and that intensive lifestyle interventions are cost effective. And lastly, I talked about screenings and policies. And this said basically that there's two approaches to prevention, screening, and treatment, and how that basically with diabetes that the effective, it's neither sensitive nor specific, positive outcome. And so with negative results, there are a lot of people being falsely reassured. So this needs to be fixed and able to have good preventive interventions.
Howdy, my name is Luis, and I chose to center a lot of my research on the educational side of diabetes. The first article I found is called Dynamics of Diabetes Counseling Clients Who Just Won't Change. And it basically talks about how there are multiple stages of change that a patient has to go through when they're undergoing treatment with their diabetes type 2. And it talks a lot about how registered dietitians have to learn how to recognize these stages of change and how to deal with them. The second article that I found is called Community-Based Interventions for Prevention of Type 2 Diabetes in Low and Middle Income Countries, a systematic review. And basically the main point of this article is that we have to screen patients for their glucose levels in early stages. That way we can prevent diabetes in the future. In a lot of doctors' offices these days, they don't really check your blood glucose levels on regular doctor's visits. So there's not really a lot of data that tells the doctor whether this person is at a high risk or not of having diabetes. And then the third article I found is called Do It Yourself Health Test. And basically, it just recommends the reader to go out to just a store like Target or Walmart and buy blood glucose meter. And basically, it encourages the person to know that if your glucose level is above 125 milligrams per deciliter, then it's a high level of glucose and you're at risk for diabetes.